人開會啦。
The appointed time and we have a quorum. This is the Joint Subcommittee on Long-Term Care Policy. First of all, I would like to say this to two members. The first item on the agenda is proposed continuation of work. As you can see on the agenda, this subcommittee needs to complete its work in December this year. The House Committee needs to choose which subcommittee is to continue. However, this subcommittee was not selected, so we have to finish our work at the end of this year. I suggest to you all that maybe this subcommittee is to be allowed to remain on the waiting list. There are 11 subjects awaiting discussion. Previously, we have proposed 18 subjects, and we have discussed 7 subjects, including today. In October, November, we will continue to have meetings. However, in December, it will be time to wrap up the subcommittee's work and report to the House Committee. If you don't mind, we will apply to the House Committee to be put on the waiting list. And if we can reactivate this subcommittee, that would be great. Do you agree? Yes. So this is done. Next is policy on subsidizing chronic patients for purchasing expensive drugs. Please invite the administration to join us. I welcome these officials. We have representatives from the Food and Health Bureau as well as from the Hospital Authority. And I also welcome deputations and individuals for coming to speak to us about subsidy for chronic patients to buy expensive drugs. I need to remind all deputations and individuals that what you say here is not covered by the Legislative Council Powers and Privileges Ordinance, which means you're responsible for what you say. Because of time constraint, I will give you each 3 minutes. Please make good use of the time to complete your submission. If we have a chance, we will give you time to give us further comments. The administration's paper is simple. It says that drugs expenditure accounts for about 10% of the HA's total operating expenditure. There are different types of medications: general drugs, special drugs, self-financed drugs with safety net, and self-financed drugs without safety net. And we find that a lot of patients, particularly those suffering from cancer disease, from cancer or serious illness, that the drugs they need may not be included in the general drugs and special drugs group. However, when it comes to drugs for rare diseases, the research and development of drugs will be more expensive. When it comes to introduction of drugs and how to classify these drugs, as well as the mechanism for use of these drugs in different hospital clusters, how the administration, how patients are handled and what are to be caught by the safety net. We think that the safety net is quite harsh. We would also like to look into issues related to subsidy. I hope you don't mind. I would like to ask the administration to let deputations and individuals to speak first before I hear from the HA and the FHB. I hope to wrap up this meeting at 1:45. First, let's hear from Mr. Yip Man Bun of the DAB. 3 minutes. Good morning, everyone. I am the deputy spokesman on policies from the DAB. This item is about policy on subsidizing chronic patients for purchasing expensive drugs. Here are our views. The DAB is of the view that very expensive drugs for treating cancer and serious illnesses should be included in the formulary. Say, for example, biopharmaceuticals. We hear patients suffering from chronic illnesses or cancer, they need to use expensive drugs. And they can't afford the medication expenditure themselves. Sometimes patients will have to sell their flat or mortgage their flats. Some patients give up treatment because they don't want the tremendous burden to affect their family members. So we ask the government to lower the threshold for drugs for chronic illnesses and cancer, so that the Samaritan Fund and the Community Care Fund CCF will be able to provide subsidy. We also ask that the program to the medicine assistant program patient contribution under the CCF should be kept at a lower percentage so that they don't have to spend all their savings and money on buying drugs. We also ask the government to strengthen support to cancer patients. Patients suffering from cancer and chronic illnesses and their family members suffer not just from the disease but also from tremendous pressure. So support is very important to them. Aside from increasing resources, there should be improvement to prenatal checks and to introduce tests for hereditary diseases and genetic illnesses. These tests should be made routine. This is to reduce the chance of babies born with hereditary or genetic diseases. Next is from the Liberal Party, Ms. Zhang. In 2017, the 31st of March, there is a surplus of $97 million. However, the government is a miser. They don't want to use money on those in need. The Liberal Party is always of the view that public money should be properly used. The FAT reserve and surplus, as well as the foreign exchange fund, should not be just used on economic development. They should be used on the underprivileged patients suffering from rare and chronic illnesses. The formulary should be expanded. Standard for giving approval should be relaxed. There are 18,000 drugs being registered. However, only 1,200 of them are included in the formulary. There are 125 drugs for serious illness and cancer. Cancer is a common illness nowadays. There are more and more cases of rare diseases. People spend a lot of money on drugs. It can easily cost you millions of dollars a year. This is a huge burden for a lot of middle class and grassroots. Some middle class people will have to mortgage or sell their flats or even not eat or drink. And grassroots can only wait till they die. However, after 2005, the HA used data including efficacy, efficiency, and clinical evidence to decide whether the drugs should be subsidized. The formulary should be expanded. That is urgent, so that more drugs will be made available for patients. This will allay their financial burden. It takes at least 1 year to approve a drug for the inclusion of the drug formulary. Some patients die before that is done. We think that there should be a proper system put in place to enable patients to use drugs that can effectively treat them, even though they are expensive. The government should do something about this. The Samaritan Fund and also CCF eligibility should be relaxed. The threshold is quite high. A lot of people are not eligible under these assistance schemes, and the expenditure on drugs seriously affect their living standard. Next, from the Labour Party, Mr. Kwok. Article 25 of the Human Rights Declaration says that people and the families should have the right to good health and treatment. And also ICCPR Article 12 also said that everyone should have the right to enjoy good health, physical health and mental health, and there should be effective measures in place to prevent all kinds of illnesses. Can the government meet these two standards? No. The government uses cost effectiveness as an excuse to not help patients in need. For patients suffering from rare illnesses, some of the drugs are the only treatment. When it comes to approving subsidy for certain drugs, it takes a very long time. They very often use excuses of insufficient clinical evidence to reject the application. And the household basis is everyone in the family. They have to pay 25%.
The right to survive is a basic human right. It is not one's choice that you get sick. There are over $1,600 billion in terms of surplus and the foreign or exchange fund reserves, so you should subsidize these drugs. The HA should also hasten the process of approving more drugs and shorten the time for vetting rare diseases so you can introduce new drugs. And also, patients cannot really participate. There are just 2 meetings where patients can go and express their views. This is not adequate. There should be transparency and more participation by patients in order to decide which drugs should be subsidized. The HA should also lower the threshold for drug subsidies so patients do not have to pay such a big proportion. 2 months ago, a lady was affected by tuberous sclerosis complex. She has these tumors growing in her body, but the subsidy is only for tumors in the brain, and she passed away. Indeed, people who need the drug, which is ulizumab for AHUS, doesn't get it, and it is only for PNH. I think you should be patient-oriented. You must improve your policy and also not be so bureaucratic. Thank you, Mr. Kwok Wing Kin. Mr. Choi Kwong Sum. Chairman, good morning. I am Choi Kwong Sum. I'm speaking in my personal capacity. This is the best time for getting sick because we have such advances in science. What we regarded as an incurable disease can now be cured, like cancers, and many other serious diseases have now become chronic diseases. But this is also the worst of times because new and revolutionary drugs are extremely good, but they lead the market, and the producers are now greedy and they fetch such high prices, so people cannot afford them. The government's position is also rather apathetic, and the Legislative Council is of course manipulated by politicians. It is becoming a rubber stamp, and you always approve the budget. Hong Kong is a well-developed economy, and we should be ashamed of ourselves because in other advanced countries, their medical expenses would take up 8 to 9% of their GDP, but in Hong Kong it is only 4 to 5%. Funding for medical services cannot catch up with the public's needs. We have a really fat surplus, 10,000 billion in financial reserves and 3,000 billion in exchange fund reserves, but you squander money on white elephant infrastructures. You won't even blink an eye when you spend billions and billions on infrastructure, which is always the subject of cost overrun. But people get sick and they don't have medication. And in terms of medical policies, you are not helping patients. You are thinking of ways and means to set up more hurdles. So cancer drugs and rare disease drugs are kept out of the formulary. I think you are very sinful in this regard. Exorbitant drug prices and also a very limited medical expenses mean that patients struggle to stay alive. Some people undergo fake divorces. They live separately in order that they can get the subsidy. And in the end, the fake divorce becomes a real divorce because they are separated and they don't get along anymore. And in order to comply with the harsh requirements, some patients would transfer their assets to other people, and then in the end they don't get them back. Also, some people are told that they should be congratulated because they have a lot of molecular reaction. And then the patient asks why. The doctor says your cancer cell is so limited that it is not detectable. And then the patient replied in saying, my money in the bank is also so meager that it cannot be detectable either. So I hope you will improve the situation. Thank you, Mr. Choi. I hope the government will respond to all these points. Ms. Wong Chi Yan. Thank you, Chairman. I'd like to make 6 requests first. Number 1, there should be disability allowance for chronic patients and the disabled. And they should get at least $2,000 in medical vouchers, which are now only available to elderly people. The disabled have to rely on CSSA. Number 3, every chronic patient and a disabled person should have care vouchers. We need a lot of care, but we don't have resources. Number 4, the government and the HA should support drugs, including first-line drugs for patients to use freely. And number 5, the government and the HA should use $1 billion on relevant organizations which directly help patients to buy drugs. Number 6, $1 billion should be given by the government to universities to research into drugs. If they succeed, the government will be able to buy the drugs at low prices for use by patients. These are the 6 requests from patient self-help groups. I like to say, if you always set high thresholds and you ask us to comply with so many requirements, it's better that you don't give the subsidy. Everyone has his own financial difficulties, and we also have to fork out daily expenses. But then we want to survive. We cannot comply with the very high threshold and stringent requirements. We just want money to help us buy drugs. You set so many conditions, and we don't know how we can even apply for one drug. But we don't need just one drug. We have multiple disabilities and we need different drugs. Thank you. Thank you, Ms. Wong, and then Ms. Lam Chan. Thank you, Chairman. At present, many drugs are expensive, and the average citizen cannot afford it. As they target drugs for cancer and also for treating macular degeneration. The government should, and actually is duty-bound to help the poor patients in the community, and such expenses should be 100% paid by the government. And so, as for those who are having some difficulties, there should be a 50% subsidy. So, please do not keep patients out of the door even if the drugs are available. A country is built by people. If the government doesn't show commitment to the people, how will you get the support of the people? Why don't you treasure the health and lives of the people? You should act in a responsible manner. You should set up effective channels to help patients who need expensive drugs. Please do not repeat the example of the lady who died 2 months ago. You should set up an effective channel for the public to apply for drug subsidy in order to protect people's lives. The procedures for applying for government funds are extremely complex and the time taken is long. Some patients waited too long for the fund. I don't think the procedures should be so drawn out. There should be a streamlined procedure for vetting and approving applications. Mr. Ronald Chow. Thank you, Chairman. I'm the parent of a patient who is affected by tuberous sclerosis complex. She is my daughter. I am the parent of this girl who is using the MPS suppressant, and it is self-financed. It used to be 40,000 for one drug, and now it is 20,000 odd. All the time, it is a big burden on our family. We urge the government to include rare disease and cancer drugs into the drug formulary. My little girl uses this drug and her IQ rose. It used to be 71. Now it is tested to be at 73. Therefore, the drug is very effective. In many advanced countries, there are clinical data proving that this drug helps. But in the beginning, the government only approved it for tumors. But that is a kind of complication only, and very few people are affected by this so-called star-shaped tumor. Other people usually would have tumors in the kidney or in the skin. I know the government is starting to discuss that the drug would also cover kidney tumors, but the threshold for the Samaritan Fund is too high. Our family income may rise, and in the end we will get zero help. I hope there will be a special fund for cancer and rare disease drugs. We hope the threshold will not be that high, and so that all drugs can be vetted and approved in streamlined procedures so patients can benefit. That is all from me. Thank you. Thank you. Dr. Chung Chi Ho from the PNH Patients Care Group. PNH is a serious disease. Your vascular health can suffer, and since we cannot afford the drugs, very probably people die. This is the drug Ulizumab, and it is the only drug that can save us. And we need injections throughout our lives. It costs $4 million per year. Advanced countries either give full subsidy or they are paid for by medical insurance. And the government is saying that they would try to subsidize us, but it is going to be problematic. We believe we should pay only $10 for using the drug every time, and also we should also cap the expenses at 10% of an individual's annual income instead of the family's assets, or else it cannot be sustained.
Well, the first lapse usually comes in one's middle age. The people will have to spend their life saving on medication. Well, even if they get their illness cured, they will become very poor. And it means that patients will have to divorce or live on CSSA. And if you require patients to pay for about $100,000 a year, it's only a small amount to the total expenditure. We do need more protection given to patients. Rare illness patients should be protected, and their expenditure should be subsidized. Criteria that is humanitarian should be set down. Sometimes patients will have to refuse a blood transfusion so that their condition will continue to deteriorate before they can receive a subsidy. Well, sometimes there are urgent cases, say for example someone suffering from embolism. Well, there are some single patients who can't find a partner because if they get married, then their partner will have to shoulder the medical expenditure as well. There should be better communication because patients don't even know about available drugs. They have to go through patient groups, and that should be improved. Thank you. Dr. Chung. Perhaps later we will ask you to explain why patients will have to make their conditions deteriorate before they can get subsidy. Next, Mr. Zhang Qinping. We have a few requests to make. First, patients with rare diseases should be properly cared for. All drugs for rare diseases should be incorporated in the drug formulary, so the patients only have to pay for the standard fee. And during the transitional period for gathering clinical evidence, we ask the CCF and the Samaritan Fund to provide subsidy, and the eligibility threshold should allow patients to live a decent life. Our alliance said that the financial means test should be based on individual, not household. Annual income should be used instead of asset. The contribution period should be kept at 10% of the income of that year. In relation to approving procedure, we see that there are lots of hindrances. The drug approval procedure is opaque. Very often, it's outsiders making the decisions. Our alliance suggests that there should be a humanitarian approach system in place. This system should be transparent. There should be experts of rare diseases sitting in the panel so that they can answer questions directly. And they need to take into account the individual situation of rare diseases cases. A meeting should be convened taking into account the condition of the patient instead of just 4 meetings a year. There should be patient groups incorporated to provide different perspectives. Say, for example, the living standard of patients, mental conditions, and also social participation. Every time a decision is made, the patient should be explained the reason why an approval is not given. And there should be follow-up treatment plan provided as well. Next, Mr. Lai Ka-wai. Good morning, everyone. I am a patient of Pompe disease. 20 years ago, I was diagnosed. Waiting is excruciating because 95% of patients don't have targeted drugs. So we will have to wait for their physical condition to deteriorate until we die. The doctor told me when I was diagnosed that one day there will be a drug to treat my disease. At that time, I chose to believe the doctor. I hope that one day there will be drugs to treat my disease. In 2006, there was a drug entering the market. However, it wasn't included in the drug formulary. Many patients will have to pay in full for the drug. In 2009, it's been listed as a specialized drug, so families don't have to go through means tests. And in 2010, I started taking the drug, and my condition becomes stable so that I can finish my study, find a job, be self-sustained. Before I found the drug, I could not imagine that my life would be improved like this. Targeted drugs for rare illnesses cannot be replaced easily. So a lot of patients will have to wait for a drug to be developed, and then when one is developed, they will have to wait for it to be included in the drug formulary. And even with a safety net, the family will have to go through means test. We are entitled treatment. That's our basic right. A responsible government should protect and care for its citizens. So when it comes to drug subsidy, is it the case that the government refuses to help us? Special drugs is very important to patients. The earlier you start taking the drugs, the more effective it is. I see that patients, when they start taking the drugs, their lives greatly improve. So patients' cases should be properly looked into to incorporate these drugs into formulary to help patients suffering from rare illnesses. Next, Ms. Lam Sin Man. People should have social responsibility. China is a very strong country. The image of Chinese people is under scrutiny by the world. Should it be people-based? Isn't people's well-being the most important? I know you don't have time. You're very busy. If government officials don't have time, shouldn't you increase manpower to solve problems for us? The government said there are many problems, but there are more solutions. If you don't have manpower, you should recruit experts to look into this, to see how these problems can be resolved. Patients know best about their physical condition. We can sit together to deal with the problems instead of just outright rejecting us. We know you are sincere. We need to give each other time. We need to sit down to solve the problems. There are more and more problems, but our society is more and more affluent. We hope to live in a safe society under a responsible government which will help us. You've heard from patients and parents. I don't want to fall ill, but if we get help, we will be grateful. They will be very willing to give back to society. We are human beings. We want people to care for us. You can't just bury yourself in books. If you care for each other, if you are all sincere, then there is hope for China. We are a very good race. We want to exist. We want to coexist. We are all equal. We all have parents. We all have the rights to live. Please be reasonable. We all should contribute to our lives, to society. We should not bury ourselves in books. Our brain is flexible. We can solve all problems. Next, Ms. Yun Siu Lam. There has been an increasing number of cancer patients. In 2010, new cases amount to 29,600. Every day, there are about 80 new cases. In Hong Kong, there is a lack of comprehensive policy for cancer patients. Patients will have to wait forever for drugs. We lag behind a lot of other countries. Cancer patients will have to wait for international recognition and affordable new cancer cases. We have to wait 3 times longer than people in France. It takes 5 years for the HA to include new cancer drugs in the drug formulary or the safety net. It will take 8 years for one to be included under special drugs. Compared to the EU, between 2003 and 2016, they have endorsed 26 new cancer drugs. However, in Hong Kong, only a third of them has been included into the drug formulary. Middle-class people and grassroots can't get these drugs. There is an urgency. Our alliance asks for these 4 things. First, to increase the estimate for drug expenditure, to include more drugs with efficacy, but the expensive ones into under general drugs or special drugs, so that more patients can use these drugs by paying just standard fees. 2, our alliance asks the government to further relax eligibility criteria under the Samaritan Fund and the CCF, so that more patients in need can benefit. Patients living with their family members may apply on an individual basis to the Samaritan Fund. Number 3, in order to pay for a huge amount of drug expenditure, well, there should be tax deductions given to these patients to allay their financial burden. 4, we are of a very strong view that stakeholders, including government departments, insurance, pharmaceutical sector, patients, scholars locally and overseas, and health groups should be invited to exchange views about solutions and plans so that there can be sustainable development. Thank you. Next, Mr. Wu Zhaowei. In 2006, an international human rights group says that the healthcare system should be equitable and efficient. We see a lot of patients suffering from rare illnesses can't get access to subsidy even though there are drugs available.
If we are talking about 1 to 5% of the 10% which is spent on drugs, if that would be for subsidizing such patients, I think that should be considered. They are not the majority. However, they are part of the public. If we can allow 1 to 5% to be spent on them, I think that should be considered. Secondly, we should review the vetting procedures for applying to the drug formulary. According to the HA, the clusters and the different doctors can make proposals for vetting by the relevant committee. We understand that in our hospitals now, we have a shortage of manpower. In other words, doctors are extremely busy. And yet, you are asking them to make proposals for drugs to be included. You are just adding to the burden. Of course, progress will not be satisfactory, and you are only holding meetings every quarter. I think the progress is extremely slow indeed. Some doctors said in public that there was no problem with the vetting procedure, but rather the efficiency of the process. And that is why there has been quite some delay, and the drugs are not allowed to be included in the formulary. Number 3, I think there should be a bigger budget for drug subsidy. We may have to purchase more expensive drugs, but if they have better efficacy, in the end they are going to drive down medical cost, because the patients will not relapse so often, they do not have to be hospitalized so often, and even if they are hospitalized, they don't have to stay for so long. Therefore, it will help to relieve pressure on the medical system. For families where there are patients with chronic illnesses, there should be tax breaks for them. As you know, people pay their mortgage for property and that is tax-free. Why don't you give tax breaks for purchase of drugs? We also hope you can lower the threshold for applying to the Samaritan Fund and the CCF. And also, we hope the government, the pharmaceutical industry and the patients can set up a committee together to help drive down medical cost. Next, Ms. Isabel Ho Kwan Ling. Sorry, I'm not going to speak today because just now our external chairman, Mr. Choi, has already spoken on our behalf. Next, Ms. Chong Kyu Yan. Good morning, chairman and members. I have twin boys. They are 6 years old, and they say, your boys are really very good. They don't run around. They are very orderly. But I am so unhappy when I hear this, because the two of them suffer from a rare disease when they were 4 to 5 months old. They did not crawl, they did not try to stand, they just ate and slept. It was so strange. And then we consulted doctors, and they told me that this was not going to be cured. My twins suffer from spinal muscular atrophy. And the doctors said that the boys will eventually not move at all, and then the muscle will suffer from atrophy. And just like Hawkins, they will just sit there like a lump. But their brains function. They can be very intelligent. But I'm the mother, and I can only watch them. They can't even hold anything. They can't sit. I find it so hard. But I have to work, or else our whole family will just sit there and wait. How can we survive like that? We collapsed. I can't describe it for you. It's really crazy. After the disease was confirmed, 3 months later, there was a drug that was invented in the US. I was so happy. And I said, right, there would be a drug. And I looked up information day and night. I looked for the efficacy, and patients of other countries post clips saying that the drug was effective. They were from the US, EU, Canada, and Japan. The drug was approved for 6 months. It was back in December, and now more and more people can use the drug. But when I look at Hong Kong, I won't be able to use the drug. The drug is very expensive. Even the entire family of over 10 persons will sell their assets will not be able to afford the drug. I hope the government can help us. It's just like what the gentleman said. They will be able to stand, they will be able to breathe and contribute to society. They will really become a person. Please save us, save my family. We are all suffering from depression. Thank you, Ms. Chong. We heard you. I hope the officials have heard you. Ms. Carol Leung, are you going to speak? Ms. Carol Leung? I'm a mother. Also, my son also suffers from spinal muscular atrophy. He was confirmed 10 years ago. The doctor said, have faith. There will be a drug in future. At present, at this moment, there is no drug, but I will wait. I will tell myself and try to convince myself. At that time, it was said that it was an incurable disease, but now we know there is a drug. I was so happy. But very soon, I despaired. I asked around. I approached the HA, doctors, experts. We could see many advanced economies and even developing countries are using the drug. The children improve so much. The drug is also in Turkey, in Japan. But I think we are not that blessed in Hong Kong. My son is in Hong Kong. He doesn't have the luck. The drug cannot come to Hong Kong. It's so expensive. Even a few generations of my family will sell blood. We will not be able to afford it. And we need the drug in the long term. So I lost hope. I despaired. It is not that I chose my son to be sick. You are born into this world, whether you are poor, you are rich, you are a certain race, you can be affected by hereditary diseases. As a mother, I see my son worsening every day. I blame myself. The whole family suffer from depression. But I force myself to stand up. I must believe that there will be a cure someday. But then I also know that there will be no chance for that to happen. So I blame myself. On the other side of the globe, the drug is available. But in this part of the world I live in, there is no cure. As a mother, I did not give health to my boy. I could not even find a cure for his disease. I really beg you. I beg you to save our children. I just like to say, we just like to survive. I beg you. Thank you. Miss Carol Leung, we are all equal. You should not need to beg us. Public money is from the public. It doesn't belong to officials. And how public money should be spent, we have given the power to officials to decide. But now we do not have a democratic mechanism to return the officials. We can only state our needs to them here, but they have all the authority. I hope your sincere expression can touch them and move them, so the high wall, the stone wall, will not be so high. Next, Ms. Yun Pui Ling from the Tuberous Sclerosis Complex Association of Hong Kong. There was no cure for TSC a decade ago, and now my girl can use a drug, but still it's very difficult. We still cannot use the drug yet. We are still waiting. because the MPS suppressant can suppress the growth of brain tumor or shrink it, or also we can have the disease checked. But now only astral tumors can be covered, and I understand we have asked for that to cover kidney tumor, but the tumor in the kidney must be as big as 3 cm before the drug can be allowed. This kind of onion peeling procedure will mean that if your left arm is sick, you cannot use the drug, but only if the disease is in the right arm. In other words, if there is a liver tumor suffered by these patients, there can be no description of the drug, and I have to wait for my child's kidney tumor to grow to 3 cm before we have the drug prescribed. This is against medical principles, and the threshold for the Samaritan Fund is very high. You must be below the poverty line. You must have no assets before you get $20,000 in medical cost subsidy every month. So people have to get really sick. You have to be in abject poverty before you get help. In society, we need to nurture useful people, but we should not create burdens for society. The government's medical expenditure is capped at 4% of public expenditure. This is only half of that of other advanced countries. And Hong Kong patients have to pay more and more for drugs themselves. In other words, you live if you have money in Hong Kong. The government spends money on infrastructure. It doesn't blink an eye in staging fireworks displays, and it creates this phenomenon of prosperity for Hong Kong. But we are talking about basic medical needs of the people. You are not looking after that. Why would we need the infrastructure if we do not have health? Is that a people-oriented target that you are going for? I hope you will soon draw up a definition for rare diseases and set up a system to treat them. I hope there can be also a list of rare diseases drawn up. Thank you, Ms. Yun. Ms. Helen Choi from the REH Association. Let me talk about REH. It is a rare disease. It's a very serious nervous system disease. It is 1 in 10,000, usually affecting baby girls. They are born normal, but by 6 months, there will be a retardation. But in Hong Kong, we do not have a definition for rare diseases. There is no special support, and there is also no support for recuperation.
My daughter's 24, and she's suffering from Rett syndrome. She can't take care of herself. Say, for example, get dressed, going to the toilet. She always needs assistance. And there is currently no drugs to treat this disease. She will suffer from epilepsy, and then and she suffers from emotional mood swing or constipation. So drugs targeting these symptoms are given to her instead of something that treats the syndrome. I see that patients suffer from mental retardation, but their body grows like a normal person. We carers are under tremendous pressure. Our child grows while we age. We don't know how to take care of them. We hope that carer subsidy should be given to us to allay our financial burden. When it comes to drugs for rare illnesses, we ask the government to take care of this group of minority by giving us support. Thank you. Thank you, Ms. Choi. Next is Mr. Leung Kwok Hong from LSD. Thank you. When I was a legislator in room 506, I had a very long discussion with someone till 9 p.m. I stayed in the office because we wanted to finish this before the end of the summer holiday. I don't know whether that can still be done. I asked you to go see a movie called At the Elephant Man. I watched it when I was a kid. The Elephant Man was seen as a freak. People hit him, criticized him, and scolded him. I was once a legislator. When there was too much money, they would give back as a refund of tax rates. They waive duty or cut tax on, say, aircraft leasing, wine duty. People who pay these duties or tax are rich. However, when it comes to people who suffer from illnesses, people who are poor, they are indifferent. I feel really sorry for people who suffer from poverty and illnesses, because not only do they suffer from illnesses, they are also too poor to get it treated. Well, the total drugs expenditure of the HA stands at $6.2 billion. You only have to increase it by 1%, then you have $62 million. I can tell you that no one wants to be ill. No one wants to claim these benefits. You only have to give it a second to think about it. You give back a lot of money to the rich. What is it to them? The day after tomorrow, there will be another funding approval given. And they said that please hurry up because it would give money to the education sector. But what about this? Carrie Lam, look at this. Get it done in summer. There is so much money. However, the government doesn't do it and shifted the responsibility onto the CCF and the Samaritan Fund. We are an affluent society. However, we ask charities to help people instead of the government doing it themselves. We all have empathy. You feel for others. So it's just like when you see a child falling into a well. Someone wants to help, you push the helper away to stop that person from helping the child. And when people put up fences, you destroy the fences so that the child will fall into the well. Do you have a sense of shame? I can't help you anymore, Chairman. We had a discussion till late at night. I thought there would be some progress. Give me 15 seconds more. Give me a roadmap and a timetable. Don't drag your feet anymore. Don't think that if you disqualify legislators and no one's there to monitor you, there are still people to monitor you. They are here, not me. If you have an iota of conscience, or an iota of a heart, you will want to help them. Mr. Leung, you are still helping. You mentioned about the meeting related to a number of the illnesses, PNH, AHUS, and also the tubular and TSC. We discussed about the progress of drug subsidy and also the threshold. The PS was there at that time, Mr. Howard Chan and the HA. Perhaps you would reply in one go all the issues mentioned by deputations and individuals, including the opaque system, the low efficiency, and the fact that we lag seriously behind other countries by years. And there's also the problem of the safety net threshold, patient participation. You've seen a number of parents being very honest with you, breaking down in tears. Then sometimes patients will have to be very poor before you help them. In some families, the whole family suffer from depression. And they see that there are drugs available, but they can't get it. Mr. Chan, shall we hear from you first? Thank you. I thank the deputations and individuals for expressing their views. Me and my colleague heard you and have it recorded. There are a number of issues mentioned and many suggestions given. We hope that we will reply to them one by one. We will give you a written reply after the meeting. And I will now give a preliminary response. Some of the suggestions is out of the scope of food and health, and I will have to talk to other policy bureau before I can give you a reply. In any event, representatives of the government and the HA understand how you feel as patients or family of patients. As far as practicable, we will do our best to provide you with the best service and the best solution to help you. Perhaps I will go quickly or go over our current policy. It is to ensure that members of the public will not have access to proper healthcare treatment because of lack of means. The HA is also responsible to provide services to patients suffering from rare illnesses. Drug treatment is an important part of healthcare, but drugs is not the only area. So apart from providing suitable drugs, there are some other ancillary support given. In 2005, starting from that, there was the drug formulary put in place. Through standardization of drug policy and utilization of in all public hospitals and clinics, patients will be ensured equitable access to cost-effective drugs or those that are proven with safety and efficacy. The list under the drug formulary is under constant review. Some deputations and individuals talk about room for improvement, say for example to expedite the approval process, and also to take into consideration overseas drug availability as well as the circumstances of families and patients. Under the formulary, there are general drugs, special drugs. The standard fee is $15. There is also self-financed drugs. Under this category, the HA will make use of the safety net of the Samaritan Fund to subsidize patients to help them buy these drugs. Mr. Chan, there is limited time. We have less than an hour. You just gave us a run-of-the-mill response. Every time you give us canned or run-of-the-mill answers saying that, no members of the public will be denied adequate medical treatment through lack of means. That infuriates me, because from what you have heard, every case is contrary to what you've said. So why don't you simply respond to that specific issue? Say, for example, TSC, but you said it only covers the astrocytoma, and you don't know when that will be expanded. You will have to wait for the tumor to reach a size of 3 cm before drug is used. So you have to wait for the condition to deteriorate, or is it the case that based on clinical experience, the drug will only be effective when on tumor of a certain size? Say, for example, the spinal muscular atrophy, there are new drugs available overseas. Will they be given the drugs in Hong Kong? No, it's not a run-of-the-mill response. I'd like to explain that under the outside the general drugs and special drugs, there is a mechanism to help those in need to procure drugs. Say, for example, the Samaritan Fund. There is also the CCF to include certain drugs in the subsidized list. There is room for improvement. We will continue to improve that. And in relation to individual cases, as I've said, I will reply to that one by one. Perhaps I'll ask the HA to provide information on these individual cases. Yes, Ms. Chung or Ms. Lee. I will talk about those drugs. I know that there was a discussion about the drugs. One is for TSC. We have a cross-discipline expert panel looking into this. They have decided on the treatment criteria and also different options. Some people mention about the size of the tumor reaching 3 cm. We have taken reference from overseas criterion. And the treatment option doesn't just cover drugs. Sometimes surgery is required. We have to, the expert panel will work out the criteria. We hope that within this year, this illness will be included under the Samaritan Fund. That also includes AHUS, that is the atypical hemolytic syndrome. We hope that this will be included under the Samaritan Fund as well. Anything else to add?
Quite a few representatives said that the asset assessment and the assessment mechanism itself under CCF and Samaritan Fund can be improved. I'd like to explain that the threshold for the Samaritan Fund is 20% for disposable capital. We understand there are many expensive drugs, and but the present mechanism of the Samaritan Fund cannot apply to those. That is why recently we applied to the CCF for funding expensive drugs. We proposed that we may like to set a cap. Therefore, under this item of CCF, it is 20% of disposable capital or $1 million. we talked to patients groups, and it was said that if the cap is $1 million, is too high, because still people will find it hard to afford. That is why we have promised that we will review it as soon as possible. That is about the asset cap and whether there is any room for lowering it or doing it another way. With regard to the Samaritan Fund, I think this will have a bearing on the entire asset assessment mechanism. So we like to do a comprehensive review together, and that is whether we can improve upon the mechanisms under the CCF and the Samaritan Fund, so people who are assisted will find it more affordable. But at the same time, together with patients groups and also the CCF, we would allow this present item to go forward first. Data tell us that 90% of patients who are helped under the CCF are receiving full subsidy or a majority of the expenditure. So they do not meet the 20% threshold. Therefore, allow us to get on with the CCF item and then give us some time to do the review. After that, we will propose to amend the way to calculate assets and also do asset assessment under both funds. Mr. Chan, you have a timetable? Can I ask Ms. Chung of HA to say something? Last time at the Poverty Commission, we said we hope we could do the review within a year. And let me say also that we heard many friends and patients' families speak on the asset assessment mechanism of the CCF. We have heard you. In 2005, we started the drug formulary, and then we also started the asset assessment under the Samaritan Fund. Well, it was a kind of a targeted subsidy, which is based on patients' affordability. We also introduced deductible items. And then in 2012, the family disposable household financial resources, we said that the patient contribution should be 30%, but it was lowered to 20% in 2012. And we also included deductible items. That has been with us for a few years now, and we are going to do that review. We hope within the year we'll be able to complete the review, especially with regard to expensive drugs. And also there is the proposal to cap family disposable asset at 1 million. And we may take a look, and also new drugs are coming on stream. And we, of course, understand that patients may have difficulty with the asset amount. What do you mean by 1 year? We expect the review to be completed in the first quarter of next year. Good. Frankly, this is a very urgent matter. Just now, Mr. Chan said under the CCF, most of the subsidy is given in full. The thing is, you have designed this hole. You ask people to go into the hole, but I cannot fit into the hole. Those who can fit into the hole, of course, get full subsidy. You talk about these two funds and the limitations and thresholds. You say, okay, those who can pass the threshold are given full subsidy. But what about the majority who do not pass the threshold? Yesterday, we said that if people live together, you calculate the income of all the 3 generations and also the disposable capital. You include retirement funds. If there is an elderly person who has a retirement fund of $1 million, which is not a very big retirement amount, and that will calculate will be calculated into the disposable capital. So your present mechanism is to make the entire family poor. You will do it until the entire family is poor. As was said, you force people to divorce their spouse or live separately. This is so ridiculous. But I will now open the floor to members. Now we have some time. We have Leung Chiu Chong, Roy Kwong, and Deputy Chairman. Each will have 5 minutes. Leung Yu Chong. Thank you, Chair. I'd like to thank the deputations for coming to let us know your plight. We knew it, of course, but your presence lets us understand the situation even more clearly. But Mr. Chan, you are telling us that you will be responding to the points one by one. But what you said just now gives me the impression that you are responding for the sake of responding, instead of really wanting to solve the problem. Today we are not here to get your response, but how you propose to actually solve the problem. Many patients and their families are telling you that there is a drug but they can't use it, and they are sick and there is no way to get a cure. This is what you see. I don't want officials just to respond. Mr. Chan, you used about 10 minutes to respond, but what did you say? You just read your paper. You are not addressing the questions raised. Well, I actually don't expect a lot from you. And you also said there could be a written reply, but then I think you are just going to copy this paper. I find this very regrettable, Chairman. I regret the administration's attitude. Just now, the HA was saying that there are 2 drugs which can be used, but they can be available only later in the year. Why should people wait? You know, if you are sick, you should get treatment as soon as possible. There should not be any delay. Why only before the end of the year? Why is there such a mechanism? What is so difficult? We are here to tell you to do away with the so-called mechanisms and not to be so bureaucratic. And yet you say the fastest is by the end of the year. Yes, we are in July. There will be 3-4 months to go. But to patients and their families, 1 day is 1 day too long. There are 3-4 months. Why do we have to wait so long? And the review you talked about, the review about the mechanisms under the CCF and the SF, you are going to take a year. Do you really need a year, Chairman, if you want to do it? Why 1 year for the review? I can't understand. Why take so long? Why is it so difficult? What information do you need? How many meetings do you have to organize? 1 year? This is ridiculous. Haven't you heard the difficulties, the plights of these patients and parents who are present? Don't you have any compassion? Why do you need a year for the review? It's ridiculous. Why are you here? Are you coming for a routine meeting and you go back to your office to do routine work? What is the use of this meeting, Chairman? We want you to immediately make amends because what has been going on is not satisfactory, but you are rehashing old points. So, Chairman, what is new? I'm very sad indeed when I see these parents and also patients. What do you expect parents to do when they see their children deteriorate day by day? Yes, some drugs are expensive, I understand. The thing is, I myself have this personal experience. You are not spending the money correctly. Why do I say this? Every year I do an eye examination And suddenly the eye doctor gave me some eye drops, and he said, use it when you need it. And he gave me 4 or 5 bottles. Every year I go for an eye examination, and then again the same eye drops were prescribed. And I said, why again? He said, because I gave that to you last year, so you get it this year. And I said, I just don't need it. Why do you give it to me? And this is not the only case. You issue a lot of general drugs, which patients don't really use, like anesthetics. And you say you spend a lot of money on drugs, but you issue too much medication to patients who don't use it, and then you don't spend money where you are required to. So I don't know how to resolve these problems, and I just want to make one request. Can you not expedite the review so we do not have to wait so long? Mr. Chairman, I don't think the government and the HA are here to respond just for the sake of responding. We have heard the aspirations of patients and parents, and members, you and ourselves have met with patients, and we know that we need to treat different drugs for different diseases in a different way, and we have listed our proposals. Like the new item under CCF, I believe by August, September, we should be able to secure funding and it can be launched. As for the asset calculation and the approval threshold, why do they need more time? I can defer to the HA. But in fact, we have been following up matters. Sometimes we need to talk to the pharmaceutical companies to formulate a pilot in order to support patients. In fact, we are doing such follow-up. Ms. Chung, the Samaritan Fund review. As we said, the CCF review will start in August only. Well, actually, applications will be received starting from August. And the scope of review is not just the CCF. We are reviewing different subjects together, but we understand you are anxious that we proceed quickly. And it is our estimate that we will do the review within less than 12 months. Can I just say something more, Chairman? Yes, Mr. Leung. Last year, I wrote a few times to the HA and the Department of Health, and I said the patients of rare diseases would like to see you, but you refused. You did not even want to see me. Why? Some patients said there should be more communication. Why is it that I wanted to arrange meetings between yourselves and patients? You did not even want to see me. Ms. Chung, why is that so? I can show you the letters I wrote you. I wrote the emails, and throughout the entire year, you did not allow for one meeting with myself or the patients. It's quite ridiculous. Well, I will have to look up the information. Well, I don't think you should have said that you would refuse to arrange the meeting. I talked to Miss Sophia Chan, and she said she would make the arrangements, but then there was nothing that came out of it.
I heard that from the HA that they would not refuse. They would not refuse it, and I don't think you would. Maybe we will have a meeting to see why the HA refused to meet with patient groups. Perhaps we will work this out after the meeting. I guarantee that there will be arrangements made for the meeting. Mr. Roy Kwong. What meetings do we have this morning? I do believe that this is one of the most infuriating meeting. It should not be a drugs formulary. It should be called no drugs formulary. Compared to Japan, Taiwan, South Korea, EU, there is policy in place to formulate a drug formulary. However, a lot of drugs are not included in the Hong Kong formulary. you will have to rely on the Samaritan Fund and also the CCF. However, under these programs, they will have to check your financial status of the whole family. There is someone suffering from a spinal muscular atrophy. I have to say the name again. This is a new disease, but there are drugs available overseas. And I think the government's quite calcified. They don't want to do anything because they don't want to make mistakes. Well, they say that if the tumor size is less than 3 centimeters, then you won't get any subsidy. And because that's the reference from overseas, then why don't you adopt the practice of overseas in other areas? Put yourself in their shoes. You told us that, well, people will not be denied medical treatment because of lack of means. You talk about looking into it and waiting for implementation. There, several years later, these people would have died. Did you answer from the heart? The problem they face is an astronomical amount on drugs. It will cost $6 million a year. And there is also the PNH. It seems that there is no decision as to whether the drug will eventually be included. They are Hong Kong people. I don't even want to talk to them about the next step. Say, for example, capping the drug expenditure, negotiate with pharmaceutical companies in order to allay the financial burden on patients. They talk about reviews. It doesn't matter, but at least there should be a timetable. In October, we will come back, but I don't know when you will actually implement this. If you make a funding application to give more subsidies to patients suffering from rare illnesses, no one will oppose to you. It's a matter of life and limb. They are dying. They don't have money to get treated. They don't want to be ill. They don't want to give up on their children. They want to save their children. They just want to have a review of the drug formulary so that they can get some help. Mr. Leung Yiu-chung said that he wanted to meet with you, and now I say to you that I want to make an arrangement for a meeting between the HA and patient groups now. They said they want to do something, but this is a bureau policy. If there is no review, if they don't put themselves in their shoes, I don't see how sincere that the government will be. Just now they said that they didn't know about any arrangements. Now I give you an invitation. Mr. Chan will be happy to meet. So tell me when. August? Mr. Chan, I think you will have to invite the secretary as well. Mr. Chan, in August, when the medical assistant program was put in place under the CCF, this is actually a breakthrough. This is on top of the drug formulary. There is another avenue to help patients to access expensive drugs that is not included in the formulary. Some deputations think that if a subsidy can be made available under the Samaritan Fund and the CCF before the drugs included in the drug formulary is a merit. However, the vetting process should be improved. It's not the case that the government is inactive. So can the CCF help them 100%? This SMA, spinal muscular atrophy, is something new. Can you help them? It's not even included. It's not even in the Hong Kong market. There are many new drugs. We rely on experts of the HA to look at the efficacy. The threshold of CCF, there is a new disease. It will take 5-6 years for new drugs to be introduced to Hong Kong. How can you help this group of people? Perhaps we'll hear from Miss Chung of the HA or Miss Lee about introduction of new drugs, especially the new drugs for SMA. Parents said that overseas, in Japan or even Turkey, they have introduced the drug. What about Hong Kong? Spinraza, the new drug, was developed in December 2016. It was registered then. Patients and doctors asked about the drug. In the last patient group meetings I have met with the parent, we did our best to see what we can do, because sometimes non-registered drugs may be used. There are about 200 unregistered drugs in use under the HA if there is a clinical need. Whether the drug is registered is a commercial decision, so that is not a factor we take into account. But at that time, that wasn't available outside the US. We liaised with EU and Japan. At that time, they have not introduced the drugs. I understand that it's just registered in the EU, and so far it can't be exported to Hong Kong yet. We follow up these cases and we keep in view the latest development. If the doctor thinks there is a need, then we will look into the case. Sometimes unregistered drugs may be introduced for use in Hong Kong. What about the mechanism? Say parents would like to get this drug introduced into Hong Kong. What can be done? We have to talk to doctors. Well, when it comes to applications, especially non-registered ones, it has to be made by a doctor. And if the doctor thinks there is a need, then the doctor may make an application. So a doctor will have to make an application, yes, to the DFH to ask for importation. However, the pharmaceutical company has to be able to export. We have not received any applications. However, doctors asked, and several months ago we found that it was not to be exported in the US yet. Next, Mr. Xiu Ka-chun. I am quite sure that half of the agenda is written with tears and the other half with anger. Parents and patients themselves suffer. Well, if there is no drugs to treat an illness, it ends in tears. However, if there are drugs but there is no money to buy them, then it ends in anger. I will follow Mr. Leung Kwok Hong. Every time we talk about lack of resources, I will go through the projects, infrastructures with cost overrun. $19.4 billion, $5.4 billion, $25 billion, $4.1 billion, $8.7 billion, $57 billion of or cost overrun. I will always mention this. Every time we talk about something like that, I will give you these figures. Don't tell me that you have money. I will always stick to this. A number of issues have to be followed up on. The Samaritan Fund. The review will take a year. I would like to remind you the original intent of the fund. What's Samaritan? As you know that in the Bible, the Samaritan is a good person. Someone who helped Jesus. The Samaritan Fund should play the role of a helper. Mr. Leung Yiu-chung was quite worked up. So how many meetings do you expect to take place in a year? How many meetings? 4, 3, 2, or 1? I know you're all very busy, but as we've said that it is urgent. Who is responsible for the review? The patients and their families. Do they get to participate in the review? Or is just an annual meeting? Using 1 hour and 30 minutes to deal with it. You said it will take it has to be a year. Who needs that year? Just now you said there is room for improvement. Dr. Fernando Zheng on different occasions told you about what needs to be improved, and I will repeat it. Yesterday we talked about this PS. Well, application should be based on an individual, not on a household basis. We have said this many times. Means test is too stringent. There should be consideration to link it with income, and use income in place of disposable capital. And to review the concept of cost effectiveness. We're talking about life and limb. Is it still the same? You still talk about cost effectiveness when you reject patients to give them drugs that are of efficacy. Or did you say that they will not be completely cured? It's just to buy them more time. So there is no cost effectiveness. How do you calculate cost effectiveness in healthcare or when it comes to saving a life? We're talking about care and a Samaritan. Did the Samaritan consider cost effectiveness when helping Jesus? The approval process being too long drawn. I'm sure you have heard about this many times.
I don't know why you just rehash your old points. Can't you tell us something new? Mr. Chan, 2 points. 1, inclusion into the drug formulary and the cost effectiveness factor. And secondly, asset calculation and also the time taken. Can I defer to Ms. Chung? Let me explain. We are going to review asset assessment. We are thinking of commissioning a consultant, and that is why there may be some procedures to follow, and it is not to be done by us. Have you commissioned the consultant? Not yet. Because when we suggested a drug to be included in the CCF. It was between March and May, and we said we should do such a review. Therefore, when we said it would take a year, it should start to count from March to May, and that is why I said the entire review should be completed by the first quarter of next year. We are now drafting the tendering documents, and coming back to the contents of the review, in fact, we were not intending to talk about cost effectiveness, but the scope, because we have heard from patients that the rationale for having asset assessment is targeted subsidy, and we are talking about deductible allowances. At present, we are setting the highest percentage at 20%. All that would be within the scope of the review. And then we were talking about extremely expensive drugs, and we are going to set the cap of 1 million under CCF. That is a new proposal. The CCF would start to accept applications in August. We need the data, and yet we have to wait for applications to come in August. And the consultant will be mainly asked to review the design of the financial assessment and not the cost effectiveness of drugs. Ms. Chung, this review is only about CCF. I thought it would cover 2 funds. Well, yes, both funds. But then the CCF asset assessment is based on the Samaritan Fund assessment. Well, yes, but the Samaritan Fund started to accept applications in 2005. No, but for extremely expensive drugs, that would start in August. That is the timeline. Okay, I understand. I understand you are asking a consultant to do it, but then you have the experts here today. They are here and they have told you what they need. They are the Rare Disease Patients Association and other association of patients and parents. I hope you have heard them. I don't want to see another patient die like Miss Chi. We ask you to use the individual's income, not the family income, and you should look at income instead of disposable capital, and you should cap it at 10% of income. We have talked about that for very long. And also, we ask you to streamline the approval procedure. These have been the aspirations for many years. You don't need a consultant. I'm telling you what you should do. We have heard these views, but we need a third party to consolidate that for us. And then the number of meetings per year, you are telling us you would just wait for the consultant's report and then you would just have 1 meeting to accept it, right? Okay, we still have a little time. I'd like to see whether deputations would like to say something. Because of time constraint, if you want to speak again, that is to respond to the remarks made by officials and the HA, you have 1 minute. I see a few hands. 5. I'll start from the back. Ms. Lam Sin Man. 1 minute each. Thank you, Chairman. I hope users will be regarded as a stakeholder. We have the views that are really reflecting the needs of patients. Please do not just write papers. We are those who are suffering. We are sick and we are poor. The administration should show some commitment. You should listen to us for our most urgent needs. If you have relatives or your next generation suffering from these diseases, you would like to give them a future. We must have hope so that we feel we are in a safe world. But now we do not have any sense of security. Thank you, Ms. Wang Chi-yan. None of us patients want to die. I have lived for so long. I suffer from spinal and muscular atrophy. Now you are looking at me. We are poor. We don't have money for medication and treatment. Why do we have to die? Why is life so difficult for our carers and our families? And then they also have to pay for our funeral. But if you cure us, we will use less of your money. Why is it that in Hong Kong there is no money to help patients? Why are we only holding meetings and yet patients are not invited? What is happening? I attended a library as a book, a living book, and the social workers told us that we are the embodiment of suffering. Have you regarded us as people? Have you regarded us as consultants? Ms. Lam Chen. Thank you, Chair. The public would like the government to build fewer white elephant projects and spend more on welfare. Hopefully, there will not be long queues at A&E departments of hospitals. Hopefully, the public can be cured and saved. Recently, a friend of mine has his cancer spread, and because the target drugs are too expensive, he has chosen to wait for his final days. You are not helping people who are dying. Hong Kong is rich. Why is it that people do not get help and treatment? Miss Chi's case is one case too many. There shouldn't be such cases in Hong Kong. The administration should really help needy patients as much as possible. Next, Ms. Yun Pui Ling. Just now, Ms. Anna Lee of HA talked about the kidney tumor measuring 3 cm. From what I know, you said you accepted the views of overseas experts. But as far as I know, in Australia, if it is a TSC confirmed case, there will be full drug subsidy from the government. Is it that you have taken reference only from the harshest of mechanisms? Why don't you look at the most generous ones? You have a choice. Why do you go for the harshest standards for TSC patients? And the pharmaceutical producers are telling us that recently the US and the EU have approved MPS suppressants for patients affected with cramps, even the very young ones. And it is found that there is a positive effect on these patients. We are seeking registration with the Department of Health. I hope later on when we come to the HA for registration, please, I hope you will quicken the process of approval, so our young patients will be able to get treatment early. Recently, the pharmaceutical companies have lowered the prices, and patients groups are making a lot of effort to negotiate the prices down. I don't know what the HA has done. And number 3, a few patients have kidney tumors measuring 10 cm on one side and 6 cm on the other, and they are on the verge of dying. Do you want to see another Miss Chi? Doctors are saying there is nothing they can do, and still this patient doesn't get any medication. How can you help him? Thank you, Ms. Yun. We will certainly follow up these very urgent cases. Actually, last time, after speaking here, we already applied from the Apple Fund some drug subsidy for Ms. Chi and another patient. And the Apple Fund told me that very night that they could help. However, it was too late for Ms. Chi, and I could only help another patient. We are patients groups, and we really need to save ourselves. What can the government do for us? There are patients who are dying as I speak, and yet we are still waiting for approval under your mechanisms. I don't understand. Do you want to see more people die before you do something? The government is sitting on trillions of dollars, and they are taking so much time to consider cases, and they leave drug help to local charities. Mr. Wu, only 1 minute, please. Just like to ask a question. This so-called long-term care policy, do you have a long-term plan for this long-term care policy, or do you only tackle the symptoms, so to speak? We really want you to draw up a long-term care policy. And you take reference from overseas countries, but you are being selective in doing so. You talk about kidney tumors growing to 3 cm, and you don't talk about other examples. I hope you will really look at a comprehensive picture. And 3, please communicate with pharmaceutical companies. If I have heard about capping the price of drugs, you know about it and yet you did not pursue it. Why do you only dump the job onto the CCF and the SF? What kind of a policy is that? Lastly, Mr. Leung Kwok Hong, Chairman, it's very simple. You should tailor-make the clothing for people. But now you are not giving tailor-made treatment to patients. These patients are affected by rare diseases, and you cannot approach them like any other general patient. There must be their input when you want to help them. They are the only ones who are in this kind of suffering. That is why Ms. Sophia Chan, before she became the secretary, she gave me a message to say, I shall become the secretary for food and health. Do keep up the communication. Ms. Chan, I'm not a member now, but please WhatsApp these people, send SMS to these people, and allow them to reply. Do something during the summer. Don't just go overseas for pleasure trips. Okay. Mr. Chan, HA. Chairman, I heard the views of patients that in this review there should be more input from users and patients. The HA, after commissioning an independent consultant, should collect the views of patients groups and users.
We will follow up with the HA to do a comprehensive review. In relation to drugs for TSC, I'll see if the HA has anything to add. Ms. Lee. I don't really have anything to add. I'll forward the views to the expert panel. What about views of patients and participation? Ms. Chung, we've heard that. We are drafting the consultancy report. We'll take into account patients' views. Time's up. Let me conclude. I thank deputations and individuals for coming. A lot of them are patients and parents. You give first-hand information, you have first-hand experience. The information you give is the most accurate. I hope officials will hear you, and I hope society will hear you. Hong Kong is an affluent society. However, some people don't have money to buy drugs. It's not the case that we have to pay whatever pharmaceutical companies ask for. Some of these companies, as those attending the meeting have said, are quite avarice. We have to talk to pharmaceutical companies. Some groups have started doing this. I know that the administration has been doing something, so has the HA, but it's taken too long. The introduction of drugs takes a very long time. We hear a lot of cases in overseas when drugs are being used. We're talking about lives. As the deputy chairman said that this meeting is filled with tears and anger. I tried to be as restrained as possible. I was about to erupt. But it seems that the response or the reply from the official is simply unproportional to the gravity of the issue. There are lots of targeted drugs and other diseases, say TSC. You can't rely on a media fund or some charitable organizations to give help. The Apple fund approached me, saying that that fund starts to deplete. They are concerned that the patients they are helping might not get help in the near future, but they would like to give as much help as possible. However, the administration that's sitting on a fat reserve takes their time. It takes them forever to introduce new drugs. It takes them forever to approve a drug. I believe that had it not been for Ms. Chi, we would not have had the meeting last month, and still, we are still waiting for those drugs. Mr. Chen said that they might be included by the CCF in August or September. Well, some deputations and the individuals said that the tumor has to reach a size of 3 cm. Is it the case? Is it based on some clinical evidence? Is it the case overseas? I hope this is only the beginning. There are still drugs that are inaccessible. After the meeting, we will follow this up. We will arrange to meet the HA and the D of H to continue our discussion. The review on the financial assessment, I hope, will be expedited as soon as possible. You promised today that you would involve patients and you will listen to their views. The consultant has a responsibility to incorporate their views as well, including the views expressed and recorded. It's an illness. You should not lose any time, because every day someone may die, and it's not a small number. For some rare diseases, the number of patients may be small. However, cancer patients is numerous. Every year there are about 40,000 new cases. Patients should be treated as soon as possible. I hope this is only a start. This new mentality, new government will not, I hope, just look at cost effectiveness. You can't put a price on life. If all patients get help from the government, I believe society will be better. This is the end of the meeting. Meeting adjourned.